Good afternoon, everyone. As mentioned, I'm Vania, I'm joined by my colleague Keishia, and we are here to share about the experiences of Black families in child welfare, just some preliminary work that we have done, and promising practices that we're observing, and then opportunities for future research that we have found. So we're going to start by just sharing a little bit about the One Vision, One Voice program at the Ontario Association of Children's Aid Societies, based in Toronto. We're going to talk about some recent findings that we've had in our research studies and implications of these findings on the mental health of not just Black families, but also Black workers working in the child welfare system in Ontario. We're going to talk about resilience and promising practices. So despite all of the things that we're hearing throughout this conference even, right? Black workers experiencing and facing, Black families experiencing, where there are opportunities for best practices to support Black families and to support improved outcomes. And then finally, I'm going to just touch on some research that we're going to be embarking on over the next few months, specifically related to the experiences of Black families. So about One Vision, One Voice, I've been hearing since we've been here at this conference a lot about for us, by us. One Vision, One Voice is also within that vein. It's a community-informed program. We're housed at OACAS, and we focus on addressing anti-Black racism that we know children, youth, and families who interact with Ontario's child welfare system, we know that they face. So all of our work is funneled towards addressing ABR and improving outcomes for these families. We use a cross-sectoral approach. So we focus not just on child welfare, but intersecting systems, including mental health, policing, education, immigration, right? How these systems are interacting to create and maintain racial disproportionalities within child welfare for Black families. And we also want to be focusing on systemic and organizational transformation. So we understand we can't just be speaking about ABR, like there are a lot of conversations. And there was one person that told us at the end of a presentation, okay, all this conversation is nice, but where are the teeth? What is actually happening? What are we doing to transform the system? So we're looking then at the policies that exist. We want to be offering solutions like for revisions of policies, revisions of practices, right? Revisions of legislation within child welfare. And a lot of this leans on research. So we do engage in research. A lot of the time in child welfare, when we speak about research, it's always, okay, numbers, numbers, numbers. Are numbers of Black children going down? And if numbers of Black children are going down, it's automatic success. And we know that research is a lot more nuanced than that, right? Often qualitative pieces, so the experiences, even if the number is trending downwards, right? What are the experiences that Black families are having when they come into contact with child welfare? Are experiences re-traumatizing for Black families, right? Black staff who are being given, kind of funneled all of these Black families because, oh, this is a Black issue, you deal with it. How are these Black workers now experiencing anti-Black racism themselves? Right? So we have engaged in this Mapping Disparities for Black Families study. It seeks to address gaps in knowledge and to identify inflection points in generating, maintaining, and exacerbating disproportionality and disparities for Black families in Ontario. We explored how workers make decisions for and about Black families, how practice and policy guidelines or requirements influence the decisions, the specific dynamics of decision-making at each juncture of the continuum. So from screening to investigation, ongoing services, just straight through child welfare, how do workers make decisions regarding Black families? We used a qualitative phenomenological approach to examine perspectives from child protection workers and supervisors, agency leaders, lawyers, EDI specialists, all of whom work with decision-making, and of course, focusing specifically on decision-making related to Black families. And we use IPA to analyze interviews and focus groups that were held with 79 professionals working across Ontario. So we know a lot of the research in child welfare, sometimes it's done by individual agencies, but what we really loved about this was that we were able to have more of a provincial lens, right, and a provincial view. So based on this research, there were 4 high-level themes that emerged for deeper analysis. So then we dove into these themes a little bit more. We examined the impact of the eligibility spectrum on decision-making. The eligibility spectrum is a tool that is used in child welfare to kind of like codify, and I wish we had more time because there's a lot that was implicated even with this tool, right? And the way that tools used in systems like child welfare themselves are Eurocentric and racist. And because now I, as a child welfare worker, if I'm working in that space, I'm bound by the use of this racist tool, then automatically the services that I'm providing, the decisions that I'm making will inherently also be racist, right? So we looked at the impact of this tool on decision-making. We noted that investigations surrounding Black children and youth and families focused on physical harm, abuse, and/or discipline. And we'll talk about that a little bit soon, we will. We looked at the role of supervision in decision-making, and we also noted unnecessary investigations and over-surveillance of Black families. So of note, anti-Black racism manifests in the absence of language in child welfare tools and legislation. There is still a fear of using the word Black. We still hear, I don't know, am I allowed to say Black? Which, even if you consider, what are the implications of that? Are we seeing Black as a dirty word, as a dirty framing, right? Why would you be scared to say it? And then what are the implications then for how you yourself interact with Black colleagues and with the Black families that you're providing services for? And this absence of language we're also seeing in tools like the eligibility spectrum and in legislation that guides service delivery. So if we know that racism exists in systems like child welfare, and there's no mention of this anti-Black racism in the legislation, in the tools, then when people are reviewing it, that's not front of mind. It's nothing that they have to consider. I can consider it if I want to. It's kind of optional if I feel like it, but there's nothing mandating that I actually have these considerations while I do my work. We notice a lack of specific language acknowledging and recognizing ABR and its historical and ongoing harms. We mentioned historical and ongoing intentionally. We had someone once while we were doing our work say something to the effect of, okay, but at least now you're no longer in shackles, so I don't see the big deal. Okay, right? So people are able to see historical anti-Black racism, but the way that it manifests, it's still kind of rendered invisible, and I kind of put that in quotation marks because it's rendered invisible because they want it to be rendered invisible, right? If you were listening, you'd hear. We also noticed when there's a recognition of the need to consider race, there's failure to mention Black communities specifically. We hear racialized communities, we tiptoe around the term, but I'm not going to say Black, right? And there are deeper issues there as well, because we find when we're speaking about the challenges faced by Black communities, it's often seen as well, that's their fault. If only they would. If Black people would just behave better. You know, if Black people would just be the Canadian way or act the Canadian way or parent the Canadian way, whatever that means, then they would not be facing these challenges. So this absence of language leads to colorblind policies that exacerbate existing disparities. We also noted that mandated referrers, so people in policing, in healthcare, in immigration, in education specifically, were heavily implicated in the overrepresentation of children, Black children and youth in child welfare. So we noted that compared to investigations involving white children, those involving Black children were 50% more likely to be referred by schools. And we hear the referrals happening for some of the most facetious reasons. You brought a roti to school. You brought a Jamaican patty to school. That's not nutritious. I don't know what that is. Pick up the phone. The parent's not feeding the child, right? Not nutritious food anyway. They have braids, the cornrows, that's abuse. Why are we cornrowing hair to their scalp? That's so abusive and painful. Let me pick up the phone and call child welfare, right? We notice less than 1 in 3 investigations initiated by schools involving Black children were actually substantiated. So a lot of these calls are just trite calls. They're unnecessary. And then what is the impact of these unnecessary calls? on the Black parent, right? On the child? Are we considering even intersectionalities like immigration status, for example? I'm not familiar with the Canadian system. You're calling me for what? For a roti? So mandated reporters, including those in education, are significantly implicated, as mentioned. And child welfare workers, including equity leads and Black workers doing ABR work, are therefore having to find creative ways of supporting Black families. So we mentioned that they're bound by these tools like the eligibility spectrum, which in itself is inherently racist. So they're now trying to, okay, how can I get creative? I have to code, but let me see if I can code in a different way. So Black workers are actually doing the work to try to ensure that harm is not further perpetuated for Black families. However, we know a research gap, right? Even as we do research on disproportionality and are the numbers dropping and so on, there's not significant qualitative research on the experiences of Black families who interact with child welfare. However, for the workers doing the work, the Black workers in particular, we're noticing significant impacts on mental health. Binary perception is one that we've noticed, right? Where Black staff are viewed through two contrasting lenses. Inferior, like, how did you get here? I can't believe that this Black worker is in the management position or in a leadership role. It must be like an equity hire. You're a diversity hire, right? Wow, you speak so well. Oh, I didn't expect that you were so educated. So they're facing that coupled with, oh, you have to do the work for Black families because you'll get it, right? So just let's push all the Black families towards you, and now I don't have to think about it anymore because the Black worker is doing it, right? So this contrasting thing of you don't know your work, but also you do, being expected to do it all. And this duality is accompanied by a lack of empathy and understanding of Black workers' authentic experiences and identities. All Black people the same, right? We all come from the same place. We all speak the same way. We all have the same experiences. You're just Black, right? This can lead to Black staff being disproportionately asked to take on the more emotionally burdensome tasks without recognition or appropriate compensation. A lot of Black workers are doing leadership things in child welfare without any sort of leadership title, no sort of leadership pay. They just get all of the additional duties and responsibilities, but they're not being actually given opportunities for tangible professional growth and recognition. And we have this quote from one Black worker who said, I have 3 new cases in a week. I have cases blowing up. Police are calling me and I get overwhelmed and flustered. I prepare 2-year exit strategies. I'm like, I need to get out of child welfare. We're also noting cultural erasure for Black staff working within a hostile work environment. I don't want to use the term microaggression because often it's not micro at all, right? Just these underhanded comments, just these barriers to doing the work, right? Diversity, so an agency can say, oh yeah, we have a lot of Black workers. Diversity, but no inclusion. Where's the voice of these Black workers? When they speak, is someone listening to the Black workers? Do they feel like their experience is valued in the workplace? And then, as mentioned before, barriers to professional growth. So 2 other comments from 2 different Black workers in Ontario. They have the ultimate say, and if they have a certain lens, obviously they'll use their authority. They, at the end of the day, make the decision. I just inform their decision. I just bring my assessment, I bring my work with the families to the table, we consult, but at the end of the day, they make the decision. I feel like they are the key players, right? So that feeling of my voice isn't really counting here. Another one said, if you look at even our white colleagues here that have the same amount of years that are supervisors, they were in that supervisory role for a lot longer. That one line would always mess Black people up is, are you a fit for the team? If you aren't of the dominant culture, then how do you even become a fit for this team just by being your authentic self? So a feeling of a need to I have to code switch, I have to mask elements of myself to want to be considered fit for the role, to be able to access professional opportunities for growth, and to be able to safeguard my mental health. We've heard of the mental health impacts throughout the conference so far. Of course, we know worker burnout, chronic stress, mental fatigue, the reinforcement of trauma, and isolation. is what we are hearing across the province, that Black workers at different, stages, right, in their professional life, that's what they're experiencing. So we as One Vision, One Voice, we host an event for Black staff across the province. We try to host these events regularly throughout the year just to make sure that we are filling their cups, right? Providing opportunities for communion, for joy, for laughter, for building up. And this quote stood out from one of our last sessions. We had a spoken word artist come in. And despite all of the challenges being faced by Black workers, and we know being faced by Black families, we're saying as Black workers, as Black people doing the work, I choose my people and I choose our work with bravery. We still continue to get it done, right? Despite the barriers, despite the challenges. So one of the promising practices that we're noticing throughout in the sector is that shift, right? From the duty to report that gets those mandated referrers picking up the phone for facetious reasons, to shifting the mindset to how can I instead support Black families? So a lot of agencies, especially Black teams at agencies, are saying, when they get the calls, have you considered that this Black family may instead benefit from support, from culturally relevant resources? We are not meant to be a punitive entity as a child welfare system, right? We had another example where a mom, a Black mom, is in hospital just giving birth to a child, and okay, I don't have a crib at home. I may not have the money for a crib, but again, I'm going to pick up the phone and call child welfare because you can't be a good mom. Weren't there other solutions in that case? Why is child welfare the first call, right? So pushing back, kind of creating some sort of accountability amongst these mandated referrers, right? So we're seeing that. And at OACAS, OVOV, and our full equity team, we're promoting and supporting a shift in mandated reporters' approach to that duty to support to ensure comprehensive safety and well-being for all children, youth, and families. And this supports, it's cut off at the bottom, but this supports the work of many Black child welfare workers and equity teams across Ontario already doing this work, right? So we are intending in the next few months to actually go into the community. We're speaking to people in policing. We're speaking to people in healthcare. We're speaking to people in education and saying, listen, this is what we are observing. This is what's being observed in child welfare. This is how it is impacting Black children, youth, and families, right? We need to have accountability. There needs to be teeth to what we are doing. Having a pretty statement on a website is just not cutting it anymore. We also develop trainings and coursework. And one that we've developed and that was rolled out in September was Kujali. So Caring for Black Children is a training for foster caregivers. And Keishia was really instrumental in getting this Kujali training, developed and rolled out. So this was created to help foster caregivers enhance their ability to support Black children and youth's social, emotional, and physical well-being. It's equipping foster caregivers to navigate the interconnected systems. So when you're a foster caregiver for Black children or youth, you understand what anti-Black racism is. You understand how to help that child or youth navigate racist systems that we know that they will encounter, right? So we see this as critical knowledge, that idea of cultural identity, the harm that racism can impact, in terms of trauma and so on. And we want to make sure that foster caregivers have that awareness. And then finally, the research gap that I mentioned at the beginning, ensuring that there's an understanding and that child welfare and mandated referrers are aware of the experiences of Black families in child welfare. Again, it's not enough to say, oh, the numbers are going down, so we have one. We need to ensure that the services that are provided are culturally appropriate. The services that are provided and the decisions that are being made are not further perpetuating harm to Black families, are not re-traumatizing Black families and Black staff at the same time, right? So in partnership with researchers at the Youth Wellness Lab, at the Factor in Wentosh Faculty of Social Work at U of T, we're going to be embarking on qualitative research to understand the experiences of Black families. And we're hoping that this research will help support culturally relevant, trauma-informed service delivery, as well as the mental health of Black families. So hopefully this conference happens again next year, and we'll be here to share the findings from that from that research. And that is it from us. Thank you very much.
Thank you, Keishia, for a very enlightening presentation. It reminded me of an experience I had about 20 years ago. I was a mental health therapist in school, primary schools in Southern Florida. So a lot of newcomers from Haiti. And in Haiti, in some families, corporal punishment is used by parents. And, I would have parents sending their children who were acting up or did, badly at school with, a mark on the arm, on the leg. And I would have to tell her, don't send your child. But at the same time, I had to do the backward and do training, psychoeducation, alternative methods of behavior modification, etc. So it just remind me of these, protect and support the families, protect them from a report, because a teacher would report by seeing a single mark on the child's body, a small mark. I'm not talking about something severe, but thank you.